Good afternoon, everyone. It's my pleasure to welcome you and thank you for joining us for what will be a very informative session. I'd like to begin by acknowledging that the land in which we gather in the nation's capital region is a traditional unceded territory of the Algonquin-Anishinaabe people. We have a great deal of content packed into the next 60 minutes with a lineup of research experts from our hospital. They'll be diving into the world of cancer, Parkinson's disease, emergency medicine, and of course, COVID-19. In fact, the next hour, you're going to learn about the 5 lessons from COVID-19 that will transform health research for the next 20 years. And speaking of the future, there'll be an opportunity to hear the vision for neuroscience at the Ottawa Hospital and plans for the Neuroscience Institute at the new Civic development on Carling Avenue. We know it's been a challenging year for everyone, and like you, I'm grateful for our frontline workers who have come to work each day during this pandemic. They've handled the most challenging healthcare cases in our region, and they've helped keep us safe. But even during a pandemic, the Ottawa Hospital continues to plan for the future. Plans are moving forward to build a new state-of-the-art hospital campus that will replace the aging Civic. This new facility will not only be the most advanced in the country, but it will also be where world-class research will be conducted by some of the best researchers in the world. And in fact, you're going to meet some of them today. So let's kick things off. Please join me in welcoming Executive Vice President of Research at the Ottawa Hospital, Dr. Duncan Stewart. Good afternoon, everyone. It's my pleasure to welcome you and thank you for joining us for what will be a very informative session. I'd like to begin by acknowledging that the land in which we gather in the National Capital Region is a traditional unceded territory of the Algonquin-Anishinaabe people. We have a great deal of content packed into the next 60 minutes with a lineup of research experts from the Ottawa Hospital. They'll be diving into the world of cancer, Parkinson's disease, emergency medicine, and of course, COVID-19. In fact, the next hour, you're going to learn about the 5 lessons from COVID-19 that will transform health research for the next 20 years. And speaking of the future, there will be an opportunity to hear the vision for neuroscience at the Ottawa Hospital and plans for the new Neuro Institute at the new Civic development on Carling Avenue. We know it's been a challenging year for everyone, and like you, I'm grateful to our frontline workers who have come to work each day during this pandemic. They've handled the most challenging healthcare cases in our region and helped keep all of us safe. But even during a pandemic, the Ottawa Hospital continues to plan for the future. Plans are moving forward to build a new state-of-the-art hospital campus that will replace the existing Civic. This new facility will not only be the most advanced in the country, but it will also be where world-class research will be conducted by some of the best researchers in the world. And in fact, you're going to meet some of them here today. So let's kick things off. Please join me in welcoming Executive Vice President of Research at the Ottawa Hospital, Dr. Duncan Stewart.
Thank you, Tim. COVID has completely transformed our lives and everything about our society, including science and healthcare. Here at the Ottawa Hospital, we've had to put some of our research projects on hold at the beginning of COVID. But at the same time, we've been able to launch more than 60 COVID research projects, including 15 clinical trials, within a matter of months. It has been incredible to see the pace of COVID-19 research and how everyone is working together to develop better treatments and vaccines. Even with the vaccines now rolling out, I think we need to plan for COVID being with us for a long time. Therefore, we need to keep working on COVID, but we also need to think beyond the pandemic and apply the lessons it has taught us to future health emergencies. For example, can we harness what we've learned from COVID to accelerate research on other diseases? Can we use new technologies we've developed to be better prepared for the next pandemic? What lessons have we learned from COVID that can transform science and health for the next 20 years? I've asked 5 of our scientists to help us answer these questions.
I think the main thing that we've learned from this pandemic is that Canada really needs to have the capacity to produce their own vaccines, their own biotherapeutics. We need to have biomanufacturing that we control. I think it's really critically important to us, and I'm quite happy here at the Ottawa Hospital we have our own biomanufacturing facility that we've been developing for the last 15 years, training people who are qualified to work in manufacturing setting. And that's because we are really unique in that we have a manufacturing facility inside a learning hospital. That's something that's quite unique across the country. We're the only facility that has made vaccines and virus-based products for the treatment of cancer in Canada. And I'm quite proud of that. And I think it's really important because not only are we seeing the importance of vaccines for things like pandemics, but we know that a lot of people could be treated with these kinds of biotherapeutics, from cancer to heart disease, to neurodegenerative disease. All kinds of rare diseases can be treated through the use of biotherapeutics. And so it's critical for us to have our own biomanufacturing facility here in Ottawa.
One of the most important things we learned from the COVID-19 pandemic from a research perspective is to be innovative with clinical trials and global collaborations. And what I mean by that is working with researchers from around the world to share ideas and resources to answer questions for patients admitted to hospital with COVID-19 infection. For example, one of the studies the Ottawa Hospital participated in was called the ATTACK trial. And this is a study that looked at different doses of blood thinners for patients admitted to hospital with COVID-19 infection to see if we could prevent them from deteriorating and needing transfer into the intensive care unit for life support therapies. And what we found on this global effort by sharing resources and including patients from around the world into these studies is that high doses of blood thinners were effective at preventing patients from going into the intensive care unit and needing life support therapy. And this was really important and something that we could implement in a timely fashion to these patients. We answered this question in about 6 to 9 months. And if we had tried to do this trial on our own at this center only, or even in Canada alone, it would have taken many years to complete the study. But by sharing these ideas and working with researchers from around the world, we were able to help patients with COVID-19 infection in a much more timely way.
One of the most important lessons we've learned during COVID is how important it is to share data and science and making sure it stays open. Normally it takes us years to publish our studies. And in COVID, you saw the glimpse of what sharing was going to be like even in the first months when the vaccine was sequenced and that data was shared openly and publicly. It wasn't the actual virus particles that was used to create the vaccine, it was the data from the genetic code that was used to create the vaccine. That set the tone. And I think a lot of that work was being developed over the years, but it propelled us forward with an urgency to make sure our data and our science was available to others, and all the scientists around the world were doing the same thing. Not only the scientists, civil society. Here in Ottawa, we helped and we learned from that. And we combined data between the hospitals and Ottawa Public Health on COVID 613 or 613covid.ca. That was a collaboration between Ottawa Public Health and the Ottawa Hospital to use that data to create projections, and again, sharing them openly. We created the projections from models that people created in other parts of the world and adapted them, added to them, and again, made them public, sharing the code on repositories. This is the first time this has really ever happened, and it will change science forever. And I heard about keeping that data open myself. I heard from businesses and schools and other hospitals about how seeing Ottawa's data and seeing the projections helped them understand the pandemic and help them plan. Restaurants could see whether the cases were projected to increase and decide whether they continue to keep inventory in food or maybe watch things more closely. This This data sharing and keeping open science is unstoppable now. The science is better than ever. We can look at each other's work more clearly and reproduce it more easily. And it's one of the most exciting times, it must be, in the world history to be a scientist. So I'm excited to do that, and excited to help in COVID, and it's going to change my work, forever.
So during the pandemic, one of the biggest lessons we learned was the power and potential of virtual care. So what virtual care means is that patients would go home with a tablet along with a few devices that would help them measure their own vitals every day. This was after surgery and after they were discharged home. This really helped because what we were facing at the beginning of the pandemic especially was cancellations of a large number of what we call elective surgeries or routine surgeries. So all we were doing at that time were emergency surgeries. So these patients are quite sick coming into the hospital, and obviously with the pandemic at that time especially, people didn't want to stay in the hospital any longer than necessary. So this allowed them to go home and also feel safe because they would have their vitals being checked a few times a day. Also, they would have a Zoom call actually with the nurses every day as well too, who would check up on them from head to toe. And then finally, if there was any problems at all, we'd also had a physician involved where if there was an extra level of care that was needed, the physician would get involved through Zoom and help the patient sort out any issues or questions that they might have. Moving to the future, we can see that the Ottawa Hospital and other hospitals in Ontario are going to be looking at this a lot more carefully as I think patients feel a lot more supported in this model, and it also helps them feel a lot safer.
I think the biggest lesson from COVID-19 pandemic, if at all we want to learn, is that this pandemic has not affected everybody equally. Those who were on the margins before this pandemic were pushed down further during this pandemic, and we saw that very vividly. People who were homeless, people who were precariously housed, people who had mental health issues, or more people got mental health issues, and people who are indigenous or low income racialized minorities, people really got so much pushed down from this pandemic that we ought to pay attention. And if we have to make recovery from this on an equal footing, we got to make equity our new normal during this recovery process. And what that recovery should look like, so that we have a cohesive society, so that we have a unified society, so that we have a healthy society, we have to make partnership. Because unless until the whole society is healthy, nobody is healthy. Unless until the whole society is happy, nobody is happy. And that kind of a social cohesion, if we don't envision during this recovery of this pandemic, then we are not going to be helping ourselves. We are not going to be helping our society. We will be at the same place before this pandemic when there was so much already inequity. And if we want to work on that inequity, we have to create that partnership at every level.
I want to thank all of our experts for sharing their perspectives on some of the top things we've learned from the fight against COVID-19. Just imagine what we could accomplish if we could harness these lessons and this energy in the fight against other diseases. Before closing this session, I want to briefly thank two very special people you can see here on your screen, Irene Watpool and Rebecca Porteous. These ICU research nurses were often on call 24/7 during the pandemic to make sure that all our COVID patients had the opportunity to participate in research. I can't thank them enough for their dedication to our patients, our community, and to science. I also want to thank all of you. Without members of the community participating in research, supporting research, and inspiring us with research ideas, none of our work would be possible. So thank you so much. We're now going to switch gears a bit and talk about neuroscience, which is one of our key areas of research and one that has great potential for growth in partnership with the University of Ottawa. For this, I will turn it over to Dr. Michael Schlossmacher, Director of Neuroscience Research at the Ottawa Hospital and a professor at the University of Ottawa.
Thank you, Duncan, for the kind introduction. It's wonderful to participate in this event. I really appreciate it. To talk about the future of the neuroscience, which is the science about the brain, the spinal cord, the nerves, and how the nerves connect with the muscles, is such an exciting era here in the city, and there's such an enormous momentum that we have built over the last few years that it's just great to bring it to the public's attention. When one thinks about the future of neuroscience in our city, 4 words that help me to explain it: patience, passion, progress, and potential. What comes to mind is what we can do and potentially do and want to do for our patients through what's called disease-modifying treatment. So there's a number of brain diseases or spinal cord diseases that are absolutely incurable today. And we've shown here at the Ottawa Hospital over the last few years how to make inroads into these heretofore incurable illnesses that have such devastating effects on people and their family members. And one thing that comes to mind is, for instance, what our center has done for multiple sclerosis, where 2 world leaders, Harry Atkins, a bone marrow transplant expert, and Dr. Mark Friedman, who is a neurologist with expertise in multiple sclerosis, have teamed up 20 years ago to try to bring change to the clinic. And what they've done as a very innovative approach is to essentially find a method by which they reboot the immune system or rebuild the immune system that has gone awry in multiple sclerosis, which is rather common in Canada. It was made possible because of the progress that had been made in doing research both at the bench in the laboratory and with patients. And so the vision is that we want to do more of that and bring more disease-modifying treatments to our patients. And that will be happening at the new campus, where for the first time ever we will bring together clinicians working closely with basic scientists, with nurses, clinical care coordinators, to bring the collective expertise of people together that really need to work in a collaborative fashion to make change happen and to make further progress happen. Stroke happens in every family and affects every family in Canada. It can be a minor thing or it can be an absolutely devastating or lethal event. The vast majority of strokes are caused by a plumbing problem, where the blood flow through a large vessel or medium-sized vessel doesn't work properly, and then there's very little time, within a few hours the brain tissue dies. So to remove the clot is important. And in the past there was breakthrough pioneering treatment to do this with a medicine, but that doesn't solve every problem that's related to a clot. You actually also need the plumbing, where you actually physically go into an artery to remove the clot. And we've learned this from the cardiologists who do this for decades already. So that's where the Canadian network of physicians, in part led by an Ottawa team that are stroke experts, have made breakthrough discoveries, namely in the organization of how to best remove these clots from these clogged arteries. And that has dramatically improved the survival rate of people with severe strokes, but it has also dramatically survived those people who would have survived but then left the hospital with some disability. And because of that treatment that's implemented fast and quickly in the emergency room, people have had marked improvement in their disability scores. So it has made a fantastic difference for us neurologists who for 20 years just looked at strokes and were frustrated that we can't do much about it. So this is a made in Ottawa solution. This is something we're very proud of, and this is extremely exciting, and we want to do more of that. Another disease that we have to mention when we think about neuroscience here in Ottawa is called ALS, or Lou Gehrig's disease. That's a devastating illness that affects your muscles everywhere in the body, in particular in your limbs and in your trunk, including the breathing muscles. A made in Ottawa solution for these people who often were institutionalized, so meaning the last few months they had to live in a hospital setting, was the so-called CanVent program, by which we bring respiratory support to their homes, and that's where everybody who has an incurable illness or a severe illness wants to be. So something, again, we're proud of. We want to do more of it, and we also want to do more of the clinical trials that help to modify the course of ALS to bring it to a halt. Parkinson's disease is usually a late onset illness, is also incurable, and one of the major initiatives that have taken place here in Ottawa is to bring an excellent neurosurgeon to the city. His name is Dr. Adam Sachs. He came from Stanford University and he built the deep brain stimulation program, which has been very successful, by which electrodes manipulate misfiring regions of the brain to try to normalize movements, and that is just wonderful. But he didn't stop there. He actually linked this to wonderful, innovative research activities that actually involve the patients in the operating theater. So this is fancy. In a sense, it brings virtual reality together with deep brain stimulation, neurosurgery, and the whole team that combines what needs to be done from a surgical front with the best possible outcome for the movement disorder control of the patient, and cutting-edge research to then prepare for the next period of manipulating abnormally firing brain centers. So that is something that we're really proud of as well, and we can't wait to build on that. We've had phenomenal support, extremely generous and hardworking people who have raised over $1 million for us to help develop Parkinson's disease further, such as through the Piper Network. This is Partners Investing in Parkinson's Research, who year after year have come together to raise money for us, which otherwise wouldn't be able to fund seed projects such as what Dr. Adam Sachs is doing. And for that, we're extremely grateful. And that again brings it back to the collaborative spirit here in Ottawa. And we want to build on that as well. Going back to those 4 words it's about patience, it's about passion, it's about progress, and it's harnessing the potential. It's absolutely wonderful to think about the future of Ottawa from a neuroscientific perspective. The ability to build, the ability to collaborate more, and to bring more changes to devastating illnesses that continue, many of them continue to be incurable. And personally, I would have never thought when I entered medicine that one day we would be able to treat stroke the way we treat it now, or that we can treat multiple sclerosis and arrest it in certain people and even improve it in others. That was like science fiction to me when I went to medical school and when I did internal medicine training, and even when I did neurology training. The wonderful opportunity to rebuild an entire campus and to bring together scientists, to bring together clinicians, nurses, pharmacists, and the entire infrastructure that's needed to make more changes happen is what excites every single one of us. We want to put, with this new site, Ottawa on the map. We want to do this for the citizens of Ottawa, for the province of Ontario, for the country and the world.
Thanks very much, Dr. Schlossmacher. And thank you to all of our guest speakers this afternoon. Now it's time for our breakout sessions. We have 3 different sessions for you to choose from, including Let's Talk Parkinson's with Dr. Schlossmacher, Grimes, Mestre, and Tomlinson. This is a great opportunity if you have questions about Parkinson's or if you're interested in learning more about the latest treatments and research. If you've ever wondered if biotherapeutics could be the next wave of medical breakthroughs, you'll want to join the session on stem cells, gene therapy, and biotherapeutics with Dr. Stewart, Kekri, Thibault, and graduate student Maria Madana. Or you can go behind the scenes in our emergency department with Drs. Venk, Valancourt, as well as Commander Shannon Leduc. They will discuss cardiac arrest, fainting, and stroke as just a few examples. You'll learn more about the huge role research plays in enhancing patient care and making our ED more efficient. To access the breakout sessions, simply click on the tab on the left side of your screen, which says Agenda, and choose the breakout session you'd like to participate in. Each session offers a 10-minute presentation, followed by an opportunity for questions and answers. You'll be able to ask questions using the chat function within the session. And should you have trouble, there will be a tab on the left of your screen called Tech Support to assist you. All right, feel free to choose your session now. Welcome back, everyone. I hope you all enjoyed your breakout session. Thank you again for all of our experts in research who joined us this afternoon. But before I let you go, I want to take this opportunity to say thank you for the generosity of our community. Over the past year, our donors have rallied to support many research projects aimed at overcoming COVID-19. Community support has had a significant impact on getting many research projects off the ground, and we say thank you for your commitment and support of the Ottawa Hospital. It's your generosity that helps create a healthier tomorrow for everyone in our city. If you'd like to learn more about the impact of your donor support or read some of our inspiring stories, please visit our website at ohfoundation.ca or follow the links under the Resource tab. Thank you again for joining us today, and thank you for your continued support of the Ottawa Hospital.